started. What does it mean here? Leave meeting, they've got it.
Can we get some help for Mary Robertson, please?
Morris, you can start.
I thought it was now Patrick who's going to give us the welcome.
Thank you very much, Morris. And so I was asked to give a brief introductory welcome. And so welcome, classmates, colleagues, and friends. It's a great pleasure to welcome you all to this occasion. And remember, much of the fun and some of the pain that we had as undergraduates and our happiness at graduation. In doing so, I acknowledge with gratitude the hard work and enthusiasm of the small group of classmates who worked so hard to put this meeting together during the restrictions imposed by the pandemic. I think it really was hard work, and I'm grateful to them. It's a pleasant opportunity to meet, even if virtually, again after many years. Who could have predicted in 1971 the momentous events such as the pandemic, but also the major advances in technology and in medicine that we've seen, and the technological advances that allow virtual meetings such as this one to take place. It also gives us a chance to reflect on and mourn classmates who are no longer with us. As many of you would know, I've remained in the UCT Faculty of Health Sciences since 1974 in various positions in 2021. I remain connected virtually to the faculty, and it's been a source of great pleasure and pride to see how the faculty has grown over the decades. The appointments of enthusiastic and gifted, highly qualified young people, and continued research output. The response of all departments, and particularly the Department of Medicine, to the COVID pandemic has been remarkable. To be able to provide the extra clinical service required while maintaining teaching and research has been a major achievement, and I acknowledge that, and I think we should all acknowledge it. That's what I've got to say that's serious. As the current dean will be speaking after me, I just have one anecdote that are all of the dean when we were undergraduates, and he related it himself. When he was asked as a student what his name was, he responded, Bromelo Downing. He was told, I asked your name, not your war cry. Thank you very much for asking me to say that. I'll respond to any questions later, Morris.
Okay. The Dean is going to speak now. Lionel.
Thanks very much for this opportunity, colleagues. And I really, I can't tell you how much I value being able to engage with alumni, particularly a group like you, who are this long away from your graduation. I'm going to step out of my picture just a little bit for you to get a sense of that rainbow. That rainbow is over the Werner Byte buildings. It's a picture taken from our offices on one of the evenings of a winter in 2020, a time when we were really struggling to get our academic program back together again. I've prepared just a couple of slides just to help me get through through talking to you about some of my reflections of the faculty as it is now. We've undertaken, can I just check if you can see my slides yet?
No.
Nothing yet. Okay, let me just do that again. Just trying to find it. There it is now. No, that's the wrong one. No,
yep, you can see it.
Yeah, that's the wrong one, unfortunately. Now this is the one. Okay, here we go. I going to get it into presentation mode. Are you seeing it now in presentation mode?
Yeah.
Okay, there you are.
There we go.
So I thought that you might appreciate looking at some of these pictures at the beginning, just because they represent the areas that you might have walked in your time here, and just to recognize the ongoing partnership that we have in the training and sustenance of the faculty in partnership with the Western Cape government. But this afternoon is essentially an afternoon of storytelling. And so I thought that I would craft what I'm saying more in the terms of just sharing with you what the story of the faculty currently is. My name is Lionel Thompson, as you may have gotten from the correspondence, but I arrived in March of 2020. I landed from Joburg on the afternoon of the 15th, went into an executive meeting that night, and on the 16th really presided over the closure of the university in anticipation of the COVID pandemic regulations that we were applying. And now, as we come to this period of 2022, we're beginning formally to emerge from that period and begin to think about who and what we are. Thyroid is a term that I'm using more frequently. That's the name that the first Khoisan people gave to this area. They valued highly the confluence of the Black and the Lispiak rivers down in the valley. And they call this place Thyroid, which really means in direct translation, the place of the stars. And in many ways, we're trying to construct that because the place is called Observatory in very much the same spirit, the place of the stars. And this bench is in our heritage garden. And we've created this garden to remember those people. So about 100 years ago now in the faculty, some of the skeletons that were used for teaching were unethically acquired from a community outside Sutherland and were brought into the faculty by a medical student and then were used in the collection at the Anatomy Museum, in the anatomy space. As we've engaged with this community, we began to plan the restoration of these remains and for burial in the community there. So this bench really speaks to the fact that we want to tell that story in a way that allows us to grow as a community. So the bench that's in that place just offers students a place of reflection. And in this slide alongside now, you'll see that bench occupied by students of a range of different degree processes, engaging and using that time, that place for reflection and quiet time possibly. And for me, quite strongly, this gathering with you is recognizing the fact that you are part of a community that remains inherently part of the UCT faculty.
What happened?
Sorry, colleagues, that was a most embarrassing moment that my computer decided it was about to shut down. So that's the story. Your story is inherently a story with us, and I will share a couple more stories as we go along. In the Institute for Infectious Diseases and Molecular Medicine, Val Mizrahi gave a lecture last year reflecting on 10 years of her tenure as the head of that institute. And she shared in that presentation that the values of the Institute are excellence, collaboration, and transformation. And they're values that have echoed for us in the last little while, and very strongly since I've been here. In particularly, and I think it was really nice that Professor Comerford referred to this, the weight of work that UCT has done, both at the molecular biomedical level in addressing the pandemic, and then in its intersection with communities, has been significant over this period. The ideas of collaboration for excellence have taken life in the way we've dealt with the COVID pandemic. It's meant that academics have worked alongside the service providers in the province and with community organizations across the spectrum to ensure that we make a reasonable response to the national crisis that ensued. This paper translated just in the last couple of weeks by a couple of these authors being included in a Nature publication, which literally was accepted in the last couple of days for publication. But I think what the pandemic has showed us is that it's not all about the micro research. In fact, it's about many other things. The picture on the left-hand side here is when in the climate of a very low vaccine confidence amongst our communities, you'll see that there are a number of us in this picture with our academic gowns. In a period between two waves, the deanery then recruited students, staff of all kinds of persuasion, academic and professional, to march down to what UCT has established as the Uct Community of Hope. So a group of about 40 of us wanted to make a statement that in fact, vaccination and the boosting thereof and the completion of your programs was absolutely crucial. And so we took the walk down to the Forest Hill campus, where UCT has collaborated with the Western Cape government in establishing the UCT's Community of Hope Vaccination Center. Some of you may recognize the picture on the right-hand side as the Da Vinci robot. And Rodowski has just acquired one of these. They've also, the province has acquired one for Tygerberg Hospital as well. But that represents, again, the other side of this highly developed clinical service that is continuing to be delivered. One that I'm sure you will recall from your days as students that prepared you for the careers that all of you have enjoyed, both locally and internationally. On the left-hand side here, again, in response to that pandemic, we saw UCT's Family Medicine Department, as well as the Public Health Department and the Emergency Medicine Division, joining forces in creating this field hospital at the Cape Town International Conference Center. A significant contribution to the offloading of care from the central hospital at Rodowski. This hospital at any point could cater for 800 patients, but never quite got as far as needing all of those beds. But important in that collaboration is the extent to which all of the services came together. And then on the right-hand side, and I won't identify her name, this is the picture of the child who received a heart transplant after a long period of a gap in the provision of children or pediatric heart transplants. So these two things, I think, represent the breadth of UCT's story. It's a story that makes an impact all the way from a primary care level, all the way to the upper levels of tertiary care. I want to just, so what we're doing at the moment is really, I was trying to give you a sense of what's going on across the board. The vision that we have of the faculty is really rooted in that notion of what we are calling igniting agency for a just and inclusive society built on health equity. And that theme of health equity is running across the reflections in the faculty at the moment, not least in trying to construct how a faculty inserts itself into communities and changes their health outcomes for the good. I think we've seen repeatedly now in the global health discussion just how serious the tensions are that emerge from inequity. And that's part of what we're trying to engage with as a faculty. One of our projects at the moment is this Archbishop Desmond Tutu Chair in Neurology. In 2019, as in gratitude for the services that he had received from urologists, many of whom have a base in the UCT space, what he did was bequeath well, at that stage, it wasn't a bequest, but it did happen right at the beginning of the pandemic. What he's offered us and given to us is the capacity to establish the Desmond Tutu Chair in Urology, the Archbishop Desmond Tutu Chair in Urology. And the idea, as you can see on the right-hand side, is really to build this area of innovative research, capacity development, and growing the benefit to society. So what we've done with the award, and I think that this Christmas period has been marked as a nation with our reflections on the Archbishop and recognizing the fact that in many ways, he became this voice that steered us along the way in so many ways. I said in a statement that we issued after his death that in every generation and for every age, men and women are called to respond to the crises of their time. And I think that Tutu did that for us. I mean, I think he's got a controversial history, there's no doubt. But what I do sense in this chair is that we can capture some of that spirit in terms of building the interface between what the needs of a community are together with the research in an area that remains a challenge in the South African society. So I'll ask Linda to send you this flyer, but we really started a campaign around the Archer's birthday in October, calling it a lighting a candle campaign, where we were going to broaden the base of people who could contribute to the establishment of the chair. At the moment, we really need to raise the funds quite quickly. Surgery has been very successful in that they've literally received a donation from Des Fernandez, a plastic surgeon locally in Cape Town, who has bequeathed who has sponsored the Dennis Davies chair in plastic surgery and plastic and reconstructive surgery. So those are some of the projects that we're doing. We are very mindful that whatever our projects are in the future, they have to address the development of people, the enhancement of our processes, and developing our spaces to become spaces that are welcoming and developmental for all who come here. So colleagues, I realize that there was some time has been given for an opportunity to ask questions, and I thought I would leave more time for that than go through a range of stuff, which we can send to you. I think, Linda, we've spoken about this group getting access to the year in review, the 2021 year in review, which was really quite a strong reflection of all the work that had been done in 2020. And we'll certainly give you access to the year in review again once it's ready this year. So colleagues, I'm really open to taking any questions. You can put them in the chat, I'll watch the chat, or if you want to raise your hands, you can. But thanks very much, Morris, for this opportunity.
That's okay. Thank you very much. So if people want to raise their hands, as I said, there's the reactions button at the bottom, and hopefully you'll jump onto screen number 1, so I'll know you're there. Otherwise, you can just, if nobody else is talking, you can just unmute and talk. Don't forget to unmute.
Professor Comerford? Go ahead, Professor Comerford.
Thank you, Morris, and thank you, Professor Green-Thompson. I was just interested in your comment that Archbishop Tutu was not uncontroversial. What part of his life or activities was controversial?
No, I think I was referring to the fact that not everybody received his teaching in the same way. I mean, I wasn't saying controversial in that he said controversial stuff. I think he took a very strong position, a very strong justice-aligned position. But there would be parts of our community that didn't receive that message with grace. And I think that's really what I'm referring to. I mean, I hope I'm not creating the impression that that's a deep sense of controversy. Are you happy with that?
Yeah, well, thank you.
Okay, Michael Shepherd.
Yeah, thank you very much. That was very interesting. We have a lot of trouble in the UK about persuading medical students to enter primary care and community style practices. I wondered what the situation at the moment is at UCT and its medical school.
You know, we don't have absolute data for that, but I think we share the same struggle. We don't have a clear indication. So for instance, we have fewer than 10% of our students in the program are from rural origin. And often that's one of the predictors in the literature generally is that if you're from a rural area, you're likely to return to a rural area. And rural work is generally more likely to be primary care. The family medicine as a specialty has grown, both in its recognition within the system and in the provincial systems of government. So there are a series of registrars across that. But certainly the spaces for training in primary care are not as great as they are in the other disciplines. So it's an area that's growing. I sense that in South Africa, we still have a great number of people going into general practice, which doesn't always require specialty at the moment, specialization. So there's a fair number of people who would be in general practice, even though they may not be family physician specialists. So primary care remains a challenge. I think that that's the reality. And it's the tension that one has in a primary care system with the health system that really struggles at that level. I mean, the health system struggles at all levels, but I think the struggles are quite profound at the primary care level. So no, we don't have the absolute numbers, but I think it's one of the things that we talk about quite often.
Thank you.
Martin?
Martin, you need to unmute.
I lifted my hand to scratch my nose, actually. Sorry about that. I hit the wrong button at the wrong time. But no, I think the concerns about care in the community have been there for all of us. But one of the things that it would appear the COVID crisis has given us people who are actually more keen to go out and work in more isolated situations than crowding around inside a busy operating room. And
yeah, I mean,
all of us.
No, Martin, I think you make a really important point. I think that I mean, a couple of anecdotes from our situation. We've just established a new department in the faculty, which is called the Department of Family, Community and Emergency Care. And the purpose of that new department is exactly to foreground the notion of generalism. And I think so in that department, the divisions which are housed in that department are going to be family medicine, sports and exercise medicine, emergency medicine, the Directorate of Primary Health Care, the division of integrated palliative care and medicine. So they'll all be housed in this department that is beginning to look at that first encounter care across the system. And I think you're right about the pandemic. It's really revealed there's a bit in our local media around the fact that we haven't really quantified the impact of general practice on the COVID pandemic and the delivery of care in that period. Thanks. So are there any more? Michael again?
Sorry, can I ask another question that I watched with
I'm
interest?
sure. I think Morris will shout when we're at the end of our time.
Okay, when from afar, but the progress towards some form of national insurance or national health service across the country. What's your view? Do you think it's likely to happen? Is it going to be a very different proposal from what we read about? Have you any strong views on it?
I mean, we're currently in a conversation with the province in the Western Cape, and you know that the political alignment of the province is DA, and the language that they use is universal health coverage, and engaging with the system in a continuous way to look at universal health coverage. I think that there's a bit of a crisis of confidence in the health system at the moment, that I think that even though the bills have been passed and there's a fair level of engagement around the legislation, I'm concerned that there may be a slow progression from here, because what the NHI bill does is vest a high level of central control of financing and engagement with service provision. I think that that's going to come under pressure over the next couple of years, because I think that all of us have submitted comments on the legislation at various stages that have been critical of some parts of the legislation. But I get a sense that the climate that we're in now will mean that there's a pressure on dramatic changes which demand a centralization of funding processes. I think it's going to remain on our agenda. I would just think that the speed at which we can achieve that is going to be different. Certainly less enthusiastic than it might have been 5 years ago. But I think very central in the faculty's conversation and the faculty's engagement with the province is the sense of universal health coverage and how the service reaches people across the board, regardless of their socioeconomic status.
Thank you very much.
Could I make just a quick comment? I think the problem that we face with the NHI is a lack of confidence in central regulation. Any other enterprise that the government has been involved in has been a disaster. You can look at South African Airways, you can look at Eskom, you look at the rails. Do we want the only functioning thing that's still left, which is healthcare, which functions to a large extent? Do we want them to mess that up as well? Or how do we reestablish confidence and get it done properly? That's our problem.
I suspect I was saying what you were saying a little bit more diplomatic, Adrian. But
I'm not diplomatic, I know that.
But I think that's the tension in the system, is that in the current format of the legislation, it's the centralizing of resource control. And that's the tension in the system, I think.
Not gonna work.
Professor Comerford, I think I keep forgetting whether your name is Patrick or not. Is it Patrick?
It's Patrick, yes.
Okay, so I hope you don't mind if I call you Patrick then in the next iteration.
Please,
I just wasn't sure I was getting the name wrong.
Pat or Patrick,
Please go ahead, Patrick.
I just want to support Adi Horrick, and in fact, I think the whole nation is distrustful of this whole national health insurance project as it stands.
Yeah.
And particularly the scandals that caused our previous Minister of Health to have to step down was around a massive tender for advertising and promoting it. So the true answer is that I think the country is very suspicious of the whole NHI proposal. And in fact, I support Adi. Central government has not managed to make anything work properly, and NHI will just be another trough for the comrades to feed at, I'm afraid.
Yeah, I mean, I think that I hear that critique, but I think that in health, we do find a number of really talented individuals engaging with the policy development and reflecting on that. So at some point, one hopes that prevails. But I think the points you're making really do reflect the levels of distrust we've achieved or we've gotten to. I accept those comments completely. I think what there is a unified reflection on is that we need to ensure that there's greater equity in the delivery of healthcare and the achievement of access. Patrick, go ahead. Did you have your hand up again?
No, sorry, it's a legacy hand.
I suppose in this group, it might be problematic to say old hands. Morris, do you want to make a question, or are you coming to stop us?
In the UK, the funding of the health service comes from general taxation. And there's an American body called the Commonwealth Foundation, which compares 11 countries, they're all first world countries, on all sorts of measures, one of which is the funding. And basically, although the UK has got its big problems in terms of health outcomes, which are not very good, it scores highly in terms of funding that this sort of it comes out better than, say, the Australian system where there's insurance, because you have a great big body which runs insurance, which that's a lot of paperwork and expense. So, of course, what is important is how it all works. But in terms of wasting money, the conclusion of the Commonwealth Foundation is that central taxation is the most efficient way to fund the service, as opposed to run it.
Yeah, I think that's a tension in the NHI conversation, is funding versus delivery. And I think we're going to remain in a bit of flux in that area for some time, but I think that it's really moving in the direction of the NHS kind of model. It would like to move in the direction of an NHS model. So Morris, I think we're at the time. mean, I think you're booked to go on until 7:30. I hope you won't mind if I slip out in the middle. I'll listen to a couple of your stories and then I may have to leave.
Okay.
If you
Melody,
don't mind.
I
But
think
thank
is
you very
better.
much for this opportunity to speak to you. I really look forward to engaging with you and for you to liaise with my office and any ideas that you have. I've come to the question of alumni relationships is really as recognizing the legacy that you contribute to UCT or have contributed in the past, and the wealth of experience and thoughtfulness that you may bring to how we consider things going forward. I really would value ongoing engagement with your class. I've just rejoined. We've just established an alumnus group for the 1988 class of medics from WITS. And I've been really quite taken by the richness of the engagement in that group. I mean, we're about 145 in the group at the moment, and it's got a good conduct. People don't get belligerent in the group, but it's been really a great way for me to stay in touch with people. So I really value this occasion. Thank you very much, Morris.
Well, thank you
And to
very
the
much.
staff in my office for getting it together.
Thanks so much for your presentation and for what you've just said now. I think Melody is going to take over for a while. Is that right, Melody?
That's correct. To my dear friends and classmates, this little session humbles me, and I hope that I can do justice to the cause. It's quite natural that in a session such as this, we would all be reminded of those of our colleagues who are no longer with us. So we've set aside a moment of solemnity and remembrance to call to mind those of our group whose lives and careers were cut short far too early. In a healing profession such as us, we are no strangers to death. But we all know by now the pain of losing those close to us. We know the pain of losing partners, and there are even some in our group who've had the severe heartache of losing a child. We remember the passing of great mentors of our faculty whose teachings have impacted and have created us into the doctors that we are, enabling us to reach great heights, not only in South Africa, but across the world. I often feel that in many ways, ours was a really privileged time in the medical school of UCT from an academic point of view. Many of us have shared the devastation that COVID pandemic has caused with losses of friends and colleagues. People we know who have died, but people we know who will never be the same as a result of the effect of COVID. The faculty has given us a list, and we truly hope that this represents those members of our class who have passed on. To be honest, if there are names missing, if people have been omitted, please know that there was no intention whatsoever, and we would be deeply sorry if that has happened. When I think back to our time at medical school, the first loss that I recall was that of Mike Foxen. A couple of days before InterVarsity of that year, I attended a sing-song preparation that we were going to do at Stellenbosch for InterVarsity. We learned songs like Die Aatjies Wen InterVarsity, not that we ever did win any. A couple of nights later, Mike Foxen was killed in a railway crossing accident between Cape Town and Stellenbosch. I do that trip quite often. It's interesting that every time I pass the spot, I think of Mike Foxen. So each of us has maybe songs, faces, places that spring memories to mind of those that we have lost. So I just wanted to go through the list of those people who we know have died and are no longer with us. You may wish to bring to mind more people, or you may wish in the chat or in the session to follow to talk of any of these. I simply am giving a list of those who we know. Mark Averbach, William Bailey, Ramesh Bika, Lillian Buffenstein, Bill Crawford, Christian Dempers, Mike Farquharson, Brian Keyes, Paul Sakinovsky, Frank Solomon, Ellis Snitcher, and Greg Wells. We feel that it would be opportune for us to hold a moment of silence as we think about these and others who have been lost. If we could just be silent for 1 minute, please. Thank you. We had also thought that we would convey any messages from classmates who, for whatever reason, are not present this afternoon. So I would like just to take the opportunity of mentioning the thoughts of one person to whom I spoke on the phone this week. Peter Rashes worked with me in Johannesburg over the last many years, 30 years, as my referring ophthalmologist for patients who had rheumatoid arthritis and eye problems. Peter is a gracious, humble, and very astute ophthalmologist. He wanted me to tell you that old age and ill health have crept up with him more quickly than he would have liked, and he's not able to be with us this afternoon. There may be many more, and please feel free to bring this up during the chat session or during the discussion. I think that the organizers or those of us who put this together were hoping that we would be able to share as many personal things as possible. So thank you very much, and I hope that the rest of the session continues. Thank you, Morris.
Okay, so it's now open for people to contribute, but apparently Desiree has something to say which bears on what Melody's been mentioning. So if I can bring Desiree in at this stage.
Thank you. Thanks, Morris. Again, I just want to thank the organizers for arranging this and making it happen. It's not that easy with so many of us all over the world in different time zones. And I just wanted to say thank you again. After this serious and informative discussion, not to mention a touch of nostalgia and the sadness of the moments that Melody spoke so beautifully about, the ones who are not with us today. I would like to just move, if I may, to some memories on a happier note and in a lighter vein. So I know we're shifting gears from being very intellectual to being a little lighter. So what I really wanted to share was that in anticipation of this Zoom, so many memories just came flooding back. Memories flood back at all times, but particularly in anticipating this Zoom. And of course, they're long-term memories, I have to say. But I thought that as these memories were coming in, I thought, you know what? This is memories of a septuagenarian, looking back at a time of over half a century ago. And it's quite amazing to even think about that. But as a confession, and at the same time a disclaimer, I would like to tell you very openly that I have been accused and found guilty by a CEO of a hospital where I had privileges of having an amazing skill for being able to condense a 2-page document into 3. So please bear with me when I talk about the memories and try to condense them, because it's pretty impossible. But by way of doing this, I thought I'd just mention a few memories of our 3rd year. After the busy first and second years, 3rd year was a breeze, our goof off year. And this is what comes to mind. Brad, the pharmacology exam in formal dress, and I will forward a couple of pictures after the Zoom next week. And I have a photograph of Bernard Lehrer and me. Bernard in a bow tie, me in a long dress, waiting outside Jammy to take our pharmacology final in formal gown. And next to us, and I know somebody here is going to be very surprised, is Janie Adams in her formal attire. And I promise you I'm going to send the picture. But then if we talk about pharmacology, we have to recall Professor Sapika. And I know that most of us remember that sentence that he said when we were trying to answer his questions. Don't throw words at me. If only I could remember some of those words. And finally, the 3rd year memory takes me back to our responsibility of the goof off year to run the talent show. And Joan Barb was Hesselson then, and I had the audacity as 2 untalented duos to perform a lip sync of a famous aria from La Traviata. I just want to say that Joan called and told me she's unable to join today and conveys her best wishes to everybody. I know you all remember Joan. So because this is my attempt to be brief, I'm not going to talk about the 4th year of Professor Kench and my masochistic, bizarre love. So I'm going to go on to a little surprise now and tell you about Joe Lazarus, whom some of you in Cape Town may have known. He was an older GP practicing in Cape Town. And he had a yen for writing limericks and rhymes. And he wrote these limericks and rhymes about his colleagues, who we as this class of 71 know very well. Dr. David Stein and Dr. Archie Michael. And if I could have your indulgence, I'm going to read about David Stein, and the title is King David. My friend David Stein has both brawn and a brain, and his surgical skill is colossal. He's equally deft with a bad natal cleft or removing a cyst hypoglossal. But he seems at his best with abdomen or breast as he slashes and stitches with glee. And removing a cyst the size of his fist, he turns and says, let's break for tea. Then it's back to the table as soon as he's able to put on the gallbladder shows. It's open and closed so fast, I suppose he's done it all right, but who knows? But the patient survives and outlives several wives, which is proof that the job was okay. He says, use David Stein for an op without pain. It's worth it, whatever you pay. Dave says it's not right to work day and night without ever stopping for fun. When he's finished his slate, he goes home rather late to laze by his pool in the sun. There he dreams up new ways to get to your guts by devious routes and intricate cuts and brilliant technique and a wonderful style, and he drifts off to sleep with a satisfied smile. Now bear with a little smuttiness in the next one. Dr. Archie Michael. Archie Michael and the menstrual cycle are linked like a horse in the carriage. Young girls in their dozens, aunts, grannies, and cousins consult him before any marriage. He fixes their insides with douches and paps, stitches the cervix, gets rid of the claps. It has even been said that with sex change, perhaps you'll make a blonde Venus from one of you chaps. There are thousands of babies with one thing they share. They wouldn't be here if he wasn't there. All of them know Archie Michael's true worth for helping them out at the time of their birth. He's said to have doubled the town's population by nurturing products of insemination. And many can thank Archie's skilled interference for giving their pubis a whole new appearance. Many a man who beds a new wife owes much of his pleasure to Archie's skilled knife, and dames menopausal and flushes galore queue up in their hundreds at his office door. He soothes them with hormones and patches and pills. They so bloody happy they'd pay any bills. What's money, they say, I've got rid of the flush, but soon they'll be back complaining of thrush. And so it goes on in an endless progression from cycle to cycle and session to session, from papping to douching, dilating to stitching, filling the prolapse, relieving the itching. For you lucky girls, he's the best gynae surgeon. Whatever you are, he'll make you a virgin. And when you are wed and expect something tiny, you'll really be thankful for Archie the gynae. That's it, folks.
Talk, say something. You can talk.
Hello. Hi. This is Max and Tubby here from Cape Town. Can you hear us?
Yes.
Yeah. It was, I must say, it was deeply disappointing because in November I got together with Linda, Rhoda, and others, and we were going to have a get-together in the garden on the 14th of December. But unfortunately, the week before this happened, we had an outbreak of Omicron, and we were the epicenter at the time. And this was all scuppered and never happened. So it was really very upsetting. And the last time we really got together was 10 years ago, when we had a very nice dinner in Smuts Hall. Very touching, a lot of people from overseas and so on. I must say it would be interesting to see how many of our colleagues are still working. Maybe we could just get everybody to tell a little bit about themselves.
Yeah, good idea.
Sure, go ahead.
Well, let the others speak now, Morris.
Yes, sure. Who would like to speak? I was told that, sorry, okay, Dave.
Morris, as regards colleagues still working, Barry Clements, a colleague of ours, is still heavily involved in research in Australia. He couldn't make it this evening, but the Kimberley kid sends regards to all of you. On a more light note, the only thing I remember about pharmacology tutorials was Prof. Sapika reminding us that you can forget everything about pharmacology, but don't forget one thing. You can never get a square meal out of a round tablet. And that's all I remember of pharmacology, although I became an anesthetist. That was good times. Thank you.
I was told that Lorna Cent was going to contribute. Is Lorna around?
Hello, Guy Jones.
I'm here.
Okay, Guy, Lorna next.
Hello.
So did you want me to talk, or Guy?
Yes, please, Guy.
Oh, ladies first. Ladies first.
Okay.
No.
Okay, Lorna, fire away.
Oh, thank you. I thank everybody for arranging this. It's quite exciting to see everybody that's available to talk with us. I'm in Vancouver. I'm not working, as you invited people who are working, but I do have one of our friends here who is working, and hopefully he will identify himself. I identify him and ask him to talk later. That's Mike Berman. So Mike is still quite active here. I would like to say that I hope other people have been able to keep contact with others. I have been so honored to be added to a group of friends who we WhatsApp almost daily, what's happening in our lives. And through COVID, it's been very helpful for us to have some support from someone else. Otherwise, things are really good in Vancouver. You've heard about our awful year of not only COVID, but also the environmental happenings that we've had. We've had bad wildfires, we've had the atmospheric river, which has caused a lot of flooding, and now we've had the deep freeze. But it's now 8:21, the sun is actually shining, and it's not raining. So thank you. I just want to keep things very light, and hi to the ladies in my WhatsApp group. It's good to see you. Thank you very much. That's it for now. Bye.
Yeah, thanks, Lorna. David, Guy?
Oh, okay, let me say something. I thought, thank you so much for all this. It's great. The Dean's introduction was nothing short of spectacular. But as to who's still working, I think it's a side benefit of the whole disastrous pandemic. I was forced to spend 5 weeks not working. And I never want to have that again. I will not retire. It's boring, thoroughly boring. So yes, I'm working, and I really have enjoyed being here so far. I do want to thank you too for sending that picture of the class as we looked in 1971. And I say this as a plastic surgeon. Everybody looks almost the same. It's quite remarkable.
It's just tongue in cheek, is it?
I think we've got to find you a good ophthalmologist somewhere along the line so we can look at the pictures more clearly.
I should say that people I know who've retired have had very mixed feelings about it. One person who's up the road says it's been a catastrophe, and another person I know says it's the best thing that's ever happened to him. So it's quite a varied response.
Yes, I'm still working. I'm a cardiologist. I work flat out. I still, every day, full on, and I think it's great. I like it. I have to because I'm still supporting kids. 3 of my daughters are all qualified now. One's a gynecologist, one's a teacher, then did psychology. The other did law and was a lawyer. Now she's just this year qualified in medicine as well. So she's 33, and thank God she's at last earning some money. So maybe I can slow down a bit. But apart from that, I love my job. I can't think of not working. It just keeps me young and active, and I love it. Well, I'm not young, but active.
Hey, Michael.
So I'm still working, but I'm not seeing patients anymore. Although as an endocrinologist, some of you people might think that endocrinologists don't really need to see patients. So we have a look at the numbers and make a diagnosis, and there we are. But I'm like you, I would not want to stop. I'm a director of a couple of boards of hospitals in the NHS. And although the COVID problems have been horrific, it's been quite extraordinary seeing it in a sense from the other side and seeing all the numbers as they come in and seeing the planning that's gone through. It's been quite a tough time. I mean, just one sort of bit of reminiscing around medicine, as that I ended up doing medicine because of Bill Hoffenberg. He was a family friend, aunt worked for him. I was going to be a mathematician, and again, endocrinologists like numbers, so that would have suited fine. But he persuaded me, and he then, of course, as we know, had to leave. And some years later, I ended up as a lecturer with him, and then ended up, in fact, in the chair of medicine that he held before I went on to become vice principal of the university. And it's just it's coincidence or it's luck. That there's some expression that I quite like, which said, luck is when determination meets opportunity. And there is a certain amount of that, isn't it? When an opportunity comes in, grab it and see what happens at the end of it without too much thought. And my training at UCT has helped me in incredible stead, as well as the great friendships. And it's fantastic seeing some of the people around today who I've not seen for a couple of years because we haven't been back to South Africa for a while. But it's been, in spite of it being online, I think this is a superb occasion, and thanks very much to everybody.
Michael, can I just give you a quick anecdote about my first thyroid clinic when I was a junior registrar? I had to go to a thyroid clinic, and Brian Kramer was a senior. I said, Brian, what must I do? He said, it's very easy. He said, you sit at your desk and the patient comes in the door. You'll either come in too quickly or too slowly.
Well, absolutely. Not like a cardiologist.
Oh, okay.
John Evans.
Hi. No, I'm not on mute. Good. I just wanted to pick up on some of those points. First of all, I have been retired for 5 years, and I'm absolutely loving it because it gives me time to explore all sorts of other fascinating areas, which when you're in the thing of healthcare, you are always focused in healthcare. And I'm now looking at Australian Aboriginal ways of how they remember their history, their culture, where food is, the landscapes, and have been doing this for 60,000 years. I think we've got a lot to learn from the Aborigines. Some of you may know that I graduated as a pediatrician and then had a midlife crisis along the way because I had implemented a computerized practice management system, got involved in health informatics, and eventually changed my career completely into one dealing with computers in healthcare and electronic patient records. And that has been my role for the past 25 years. But when I started that, and sort of taking back to what Lionel was saying, I was involved with computerized systems with a number of the big medical schemes in South Africa, and had a look at the whole concept of what was called managed healthcare and what was going on in the States. And I think, though I agree with all the comments about the concerns about introducing the NHI, from my point of view, having seen the impact of insurance-based funding, it always has innate problems. And that's one of the reasons why the NHS is such a great organization, is that it is not based on actual insurance and claims against the insurance. It's about services at point of delivery and ensuring an efficient and proficient care. And I think that is something that needs to be really considered within the discussions in South Africa, because that should be considered in the way they shape the NHI. Thank you.
Thank you.
Could I respond? I had to do all the talking. Our problem is not the same as Europe. We have 4.5 million people paying tax in this country. We have 60 million people living in the country. There's 14 million people on government grants. We cannot afford an NHI unless we find funding from somewhere. And the tax is being screwed out of the very few people. There's no more money for it. That's what our problem is. So it's fine to say in Australia, where what percentage of the population are working and paying tax, it's fine to say we can tax a bit more and pay it. We've got a real problem here. I don't know where the money's going to come from.
So Adrian, where would the money come from in an ideal system? What would fund your health?
Well, if you've got 60, 70, 80% of the population working and paying tax, that's where the money comes from. Our unemployment is over 50% in this country. That's the problem, guys.
I would tend to agree with you completely, Adrian. It's a fundamental change in the socio-economic approach within South Africa that needs to happen for any of this to come right. Not just healthcare, but the whole of South Africa and where it goes. And until that is sort of met head on and dealt with, and in fact, it's the same thing that even sort of richer first world countries are beginning to face with the whole thing of climate change, without actually some fundamental socio-economic thinking, political drive, we're all going to be in deep troubles one way or another.
And the corruption, etc., etc. You have to root that.
Yes,
it costs,
absolutely.
a neon bulb that you buy at the hardware store costs R4.50. By the time Eskom buys it through their suppliers, they're paying 94 Rand for it. That's what's happening.
Yep.
That's where the tax goes. That's our problem.
Yeah. Morris, I think Max Harris wants to say something.
Yeah, Tubby wants.
Yeah. Hi, Morris.
Hello.
Hi, Morris. Hello, can I talk? Am
Yes,
I able
please.
to talk?
Go ahead.
All right. Anyway, lovely to see you all. Magnificent show you were having, and lovely to link up. And I'd just like to talk about our careers. I remember first year with Grindley, where we all threw those paper darts down when he switched off the lights. And of course, we had great times in second year with the crayfish and cockroaches. Third year, you know, with pathophysiology, and fourth year, fifth year. And then I did general practice for a while in Goodwood, and one of the partners looked after Kaiser Matanzima. Do any of you remember him?
Yeah.
Yeah, he was head of the Transkei, and I remember when he arrived in his helicopter, he came in a black limousine across the road, and everyone looked at him. And then I did anesthetics, and I enjoyed it very much, and I taught for 20 years part-time at Red Cross. And during anesthesia, you know, we had wonderful times, found my niche. And then I was asked to anesthetize late Professor Yanni Lowe. And it was very interesting because the night before I went to see him, and I just said, "Good evening, sir. I hope you don't remember me." And he said, "I remember you, my boy." But anyway, it all went very well. And I remember, you know, having conversation with Dave Mitchell, and I asked him one day what he did when they rowed across the Atlantic. You know, he rowed across. And so he said to me, he never got bored because I used to watch Desperate Housewives on the trip, and I was lucky to see Adi Horak, a few others, and Max Harris. We've been friends all the years. And I've also retired. I had COVID 2 years ago, and luckily I wasn't badly affected. And then I've also been involved with rugby, and I was on the rugby panel at Newlands. So we looked after the All Blacks, Springboks, Wallabies, English, everyone else. So it was a good career. And thanks again to you all for organizing it. And any other information you want, please contact Dave Mitchell. He's in touch with the Aborigines, as John Heavens mentioned. So he can put them on the canoe and bring them straight to Johannesburg. Keep well and have a great time. Bye-bye.
Thank you, Max.
Tubby. I'm here, but Tubby was speaking. Yeah.
Yeah. Fine, go ahead, Tubby.
That wasn't Max.
Morris?
Yeah. Hello. Graham, can you talk? Who wants to talk?
Morris?
Yeah.
I think Gulch Fuller said he had to leave. So maybe he should.
I'm back again.
Are you back again?
Back. Okay.
Okay. Can I say a couple of things?
Yes, please.
Well, you know, it depends on what you call work. I retired and unretired, so I fall in a different category. Johnny, you may get to that category still. As many of you know, I took a left turn. I did cardiology and was on the faculty at the University of Texas Southwestern Medical School for 12 years. Then went into the business world and got in on the ground floor of stents. And so we really are the people who put the stents on the map, from Johnson & Johnson, first the bare metal stents, then the nitinol stents, then the first drug-eluting stents. I'd be very surprised if there's not one or more people in this group who has been a beneficiary of that, because at last count, something like 50 million people in the world have stents. So I was very lucky, count myself very fortunate in many respects, to have been involved in something quite as exciting as that. So I retired in 2008, and I sang in a couple of choirs. I wrote a family history. I sat on a whole lot of nonprofit boards. And frankly, I was getting a little bored, and I was called in again to be chief scientific officer for a startup medical company. And we're developing a very impressive technology for treating big blood clots, pulmonary embolism, deep vein thromboses. people really may not know, but pulmonary embolism is the third leading cause of cardiovascular death after MI and stroke. So again, I find myself in a very exciting position, and I count myself extraordinarily fortunate. I have 3 great kids. Not everything has been roses. Unfortunately, my wife has had serious medical problems and continues to have serious medical problems, which is why I spend much of my time in Washington, D.C., where I have 3 children, 3 great kids. So I am actually enjoying being re-engaged and challenged and dealing with the FDA and dealing with all the agencies, seeing that I can still do it. But each one will have his own experience. The gap years were fine, but I enjoy getting back into something that is intellectually challenging. So thanks very much. And thanks so much for organizing this. It's great to see all you guys again.
Thank you, Brian.
Well, Morris, may I speak?
Please do.
Bernard Lera. Well, it's first of all, it's really great to see everybody. I don't just want to make a point, and that is this does not let anybody off the hook for a reunion in Cape Town. The only reason I guess it's not in Cape Town is because of the COVID. And the last time, the last reunion in Cape Town was fantastic. Was quite a lot of years ago, but I still remember it very well indeed. It's really fantastic to see everybody looking so well. I don't think everybody looks like they did in the picture, but I think the years have not taken as great a toll as one might be concerned they might have. I'm a psychiatrist. I specialize in psychiatry. I moved to Israel very soon after graduation, and I've been a professor of psychiatry at the Hebrew University Hadassah Medical School since then. For most of my career, I worked both in the clinic and the lab. And when I formally retired from my clinical position 5 years ago, I moved almost entirely into the lab, except for a half-day clinic once a week. And I have a very active psychopharmacology lab. I never thought in the years with Professor Sapika that I would get involved in psychopharmacology, but somehow I did. And I also work as the chief scientific officer of a company specializing in developing novel drugs from psychedelic compounds, which we all remember as being highly illegal in the days when we were young. But now they're having a kind of a renaissance. I was very sad to hear recently about Mark Aberbuk's death. I reconnected with him actually. He came to Israel. He suffered from leukemia several years ago. He had quite a rare bone marrow problem, and he came to Hadassah. There's an excellent unit there which specializes in a very particular form of bone marrow transplantation, and he came to get treatment. So he actually was a very successful case in terms of the outcome of his treatment. And I saw him quite often. He was at Hadassah hospitalized for several weeks, and we maintained contact after that. And he had quite a lot of good years in Australia. He wrote a book, and so it was wonderful to connect with him. I've seen some of the people in the class from time to time, but most of you not for a very, very long time. So it's really, really great to be here, and thanks for organizing it. And please do organize a reunion in Cape Town. I've not been back for several years. I look for every possible opportunity to go back to Cape Town, and this will be the next chance.
She wants to the other one.
Thanks very much.
They should get Marion to speak.
Marion?
Yes.
Yeah.
Who's next?
Maybe
say a few things.
Hi, Graham.
My wife and I got married the very day after we graduated. So that was the 10th of December, 1971. And therefore, we've just celebrated our golden wedding anniversary. And we had actually planned to come down to the reunion that did not happen on the 14th. But we came anyway. and we retraced our steps to where we got married and where we had the reception and the beginning of the honeymoon. And we had a kind of mini reunion, which consisted of Audrey, myself, and Pete Davies in a restaurant. It was nice to see him again. And well, it's good to see all of you as well. Some of you look a bit worse, the worse for wear, and some of you look the same as you used to. But anyway, after a couple of years in Cape Town, I went to Edinburgh and worked there for 4 years. We had a daughter while we were over there, came back to Cape Town, finished specializing in neurosurgery in 1981, and then took up a consultant post in Durban, and then went into private practice. And I was 31 years in practice at St. Augustine's. Towards the end of that time, we were having to pay 75,000 Rand a month for medical legal insurance, which really is unsustainable. It means you've got to work flat out in order to just stay alive. So I decided to retire at the age of 68. And since then, I've been doing a lot of interesting things, which are very similar to what some of you other guys have been talking about, getting involved in the community activities, etc. And life is pretty good. We have 2 children. Our daughter, born in Edinburgh, now lives in England, and today is her daughter's 12th birthday. So that's why I broke off to talk to them. And we have a son who lives in Johannesburg. He's a champion bagpipe player and a triathlete, and is a quantity surveyor working for a major construction firm in Johannesburg with a wife and 2 dogs. So that's enough about me. Thank you.
Thanks, Graham.
Yeah, I can say a few things.
Yes, please.
Yeah, so I'm saying hello to you from the shores of Lake Huron in southwestern Ontario, which is a snowy day at -2 degrees at the moment. For those of you who don't know or don't remember, in 3rd year medicine, Mark Averbach and I took off extra time and we hitchhiked around Europe. We came back, I think, 6 weeks late for the year, and we went across Checkpoint Charlie with South African passports, had our money confiscated, etc., etc. So Mark and I are very close. It was sad to see what happened to him in the last number of years. I had reconnected with him, and yeah, it's sad to see him go. In terms of retirement, I was 37 years at the University of Ottawa, and then I decided to retire in 2015, which actually lasted about 4 months. There's so much golf you can play or drive around in a boat before your brain goes stale. So I went back to work full-time for a year, and now since then I changed universities. So I'm at McMaster University, where I work 3 days of work just in teaching and research. Great to see all you guys. You all look good. I'm sure we've all had our health challenges, and as you get older, you can't escape it. I had COVID over Christmas, and then about 10 days ago developed pneumonia as a complication, but thank goodness over the last couple of days I've recovered. So good health, and thanks for organizing it. Good to see all you guys.
Thank you, John.
Morris?
Yeah.
Michael Berman in Vancouver.
Hi, Michael.
Hi, Michael.
Great to see everybody, and great to hear everybody as well. And thank you, Lorna, for the introduction. I am still working full-time, and it's very interesting as the career has gone by, one adjusts as to how you work as time goes by. I've taught for many years in ophthalmology at Vancouver, and now do much less so, and tend to do much more clinical stuff. It's been very interesting over the last number of months and actually almost 2 years as to what has happened with medicine, because I found that most of my colleagues are still doing a huge amount of telehealth. And we're actually in ophthalmology are unable to do that. You have to see the patient. So we saw patients right through the pandemic, whereas many people are still doing telehealth. But it's been good. And I will also like to just make a few comments on what Mel said earlier on our colleagues that have gone. Many of those people were actually close friends. And as we know, as we went through med school, we all had some that we were closer to than to others. I was very close with Paul Sacchi, John Dampers, Mark Averbach, and also, can't remember the fourth one, and Frank Solomon. And I spent a lot of time with Frank because I did a fellowship in the UK in 1990 and spent a lot of time with Frank. So I think of them all a lot, and it's been tough because they were very close and very good people. But other than that, I still work every day, enjoy it, and I think if I did retire at the moment, I wouldn't know what to do with myself. So great seeing you all, hearing you all, and I wish you all the best for the future. Hopefully, as Adi and everyone said, we can get together in Cape Town sometime in the not too distant future. Thank you.
Thanks, Michael.
Hello, can you hear me, Morris?
Yes, fire away, please.
Thanks, it's Mary Robertson here. Firstly, I thought I'd just like to thank everybody. It's been absolutely fabulous. I was cheerful all through Mel's talk, and then with Des Rosenthal's, I just about fell off my chair. What I just wanted to say is that I got pretty high in the UK. I was a professor at Yale, and then I took early medical retirement. And then 5 years ago, because of the perfect storm of cancer, septicemia, and pulmonary emboli brown first, I decided I didn't want to see a hospital again. And so I did change careers completely. I did a degree in music at King's College London. And it's not only straight music, it was music and opera. So Desiree, I was delighted to hear you and Joan Bubb sang Traviata. So it was opera and perfume. And I'm now, to the bore of absolutely everybody I know, and there are no exceptions, I'm writing a book on the subject, and I've got 13 weeks to go. I've written 150,000 words, I've got 200 patients of photos, and I've documented 1,215 opera perfume. And I was just said to myself here, it's just like the stress, and poor old Janie Adams has been fantastic, and it's almost the stress of MB finals. I'm like a child. All I think of is my book, but I'm also thrilled to the girls on the WhatsApp group, which I'm a member of, as well as Lorna said, and I've got a lot of associations with UCT. I've got a group of young women I've funded with either scholarships or prizes. And so I'm in regular contact with UCT. And thank you, everybody, for a wonderful afternoon.
Thank you, Mary. Very interesting.
Morris, this is Morris.
Yes,
Morris. This is Brian. Yeah. Could I just interject something, because Mel very kindly went through the members of our group who are no longer with us, but Mary contacted me about Clive Mcdell. And since Pete Berman just spoke as an ophthalmologist, and I know Pete, and there's mention of Pete Rush, Clive Megdal, you folks probably all remember very well. And the question was whether he'd be able to participate in this call. Sadly, Clive had a cardiac arrest and recovered from that, but is really not legally competent. And that happened maybe 14 years ago. He rose very high up in the world of ophthalmology. He was, extremely highly regarded. Ophthalmologists on this call will be able to speak to that. But whenever I pass through London, I pop in to see him, and Mary has stayed in touch with him. Clive is happy. He lives in his home in central London, just off Fitzroy Square, a lovely home there. But he has carers 24 hours a day, and has had for, I want to say, 12, 14 years. So, and he's been very, very well looked after by his friends, but clearly would not have been able to participate in this call. But I just thought that some of you might be interested to know what happened to Clive Megdal and why he's not on this call.
Yeah, thank you.
Can I speak?
Yes, please.
Les Landecker. I'm calling from Thornhill in Toronto. I practice in a town called Newmarket, which is north of Toronto. So I was interested to hear at Bradford at McMaster, which we're not that far away. So I didn't actually think there was anybody in our class that was in Toronto. So that's great to hear that. About Clive, 1 year I went to Moorfields and spent a week there just observing, because I just wanted a break from practice, and actually met Clive. Clive was instrumental in one of the biggest studies in glaucoma, because if a patient presents with a very high intraocular pressure, the debate was whether to do surgery straight away or to start them on medication. And Clive was instrumental in that study in suggesting that maybe surgery was a better way to go and getting a better outcome. Sorry, I didn't say I'm an ophthalmologist as well. He actually became very famous and was flying all over the world giving lectures on this. And it was great to meet him. We spent a lovely day in London. The other classmates I've met in my career was Mike Berman. Interestingly enough, there was a conference in Vancouver of South African ophthalmologists in Vancouver. And there were about 25 ophthalmologists, and that wasn't all. Some of them didn't even show up. So it's amazing how many have landed up in Canada. A lot of them went to Saskatchewan, and they came from Potch, and a lot of them were Afrikaans-speaking ophthalmologists, and they actually moved from there to Vancouver. The other people I've met Mike Rodowski in Toronto, and Rochelle Hotz. We were at, well, she's not Rochelle Hotz anymore, but Rochelle. We met at a UCT reunion in New York. They were trying to raise funds for the university, and there were a lot of attendees from all over North America at that function, and it was actually great to see her. At the moment, I'm still working mainly part-time, probably half a day, 4 days a week. I actually still want to work, but I don't work too hard. I've stopped doing surgery because that meant having to be on call at the hospital, and it's pretty arduous with us. We serve about 2 million people when we're on call. So I found it, as I got older, it became very difficult to work at night and on weekends. Fortunately, we are able to do a lot of traveling, and with being in North America, it's easy. And I've actually seen a lot, very interested in hiking, and have enjoyed some wonderful trips. That's about it for me, and it was really great to see all of you, and it would be great to meet you as soon as we can. We'll probably go back to Cape Town once COVID is settled. And thank you very much for arranging this.
Thank you very much, Leslie.
Okay, can you hear me? This is Michael Rodowski.
Hello, Michael.
Hi, everybody. Thank you for setting this up. So just a quick background. Did dermatology under Walter Gordon. Then immigrated to the US and got a job at Hopkins, spent a few years at Hopkins, and then went into private practice. Had a kind of a mom and pop sort of private practice, which is rare, solo practice. My wife ran the office and I saw the patients. And I guess when I was ready to retire, 5 years I gave myself, when I was 65, I went over to the dark side and joined an HMO. And then at the age of 70, retired. And I want to give some advice to people who don't know what to do in their retirement. There's hiking and biking. There's learning or playing more bridge. There's pickleball. Anybody know what pickleball is? It's similar to tennis set that we used to play in grade school in South Africa. There's plenty to do. You don't have to work the rest of your life. We don't want to look back and say, gee, my only regret is I didn't spend a longer time in the office. So it's interesting also to hear how children have followed their parents' footsteps. Lots of people sound like their kids became physicians as well, as did mine. He actually joined the army and spent some time in Afghanistan and Korea. We visited him in Korea, but not in Afghanistan. Anyway, it's good to see everybody. You all look alike, and some people I wouldn't have recognized. It's true. And I guess you don't know who I am either, because I wasn't a standout in the class. But anyway, thanks for setting up, and hopefully we can make this an annual event, perhaps.
Yeah, yeah.
Thank you, Michael.
Can I come back on?
Yes, please.
So in reply to Michael, pickleball is wonderful. It's great for balance. It's great for just agility and the aerobic component to that. So I'm touting retirement. I've had a great time. I retired actually in 2015, but was called back by friends to do locums. I continued doing locums for 3 years. Then I decided I had to retire before I turned 70. So since then, I've gotten back to playing league tennis, and I've just started playing pickleball. And I spend probably 6 out of 7 days in one of those activities. And also I do long walks with friends. And also traveling, Cliff and I just recently celebrated our 50th wedding anniversary. But before then, we did so many hikes. We've been to, in the past, we've been to Nepal. We've done the Great Ocean Walk. We've done Annapurna Circuit, that's in Nepal. We've done the walk in Peru. We've done the Camino. So I really think it's a great time to see the world. And I'm hoping we can get back to our traveling because we're starting to run out of time. So I really do think there's a lot to do in retirement. I also volunteer. I actually do grocery shopping for seniors who cannot get out of the house. And I have had the opportunity to talk to them when there is a product not in stock. And so I get to know some of these people too that I've never seen, but talk to them about their grocery list. The other thing I do is navigation. I work probably twice a month in shifts at the Children's Hospital and help people get to the place where they want to go. The site has actually 5 hospitals put together in one site, and you may find that somebody is looking for an area like in the blood lab with children's, but they actually come in the maternity area. So I escort them to these areas. So I find volunteering very, very rewarding in that I get to meet other people, and I meet a lot of young people. These are usually university students trying to get the hours in volunteering. I also would like to just mention that Clive Mcdell was born in East London, where I grew up, and he was a really good friend of a classmate of mine. And so when we met at medical school, it was great to have a connection. And I have visited him several times in London, and also after his cardiac arrest and his recovery. And Mary Robertson has been instrumental in getting me in touch with him. And hopefully next time I go back to England, I'll get to see him again. So now I'm going to tout my husband. Cliff has published a book, The 10-Minute Physical Examination. Excellent, well illustrated, and he wrote it because the students are not being taught how to examine patients. So it's available on Amazon by Clifford Chan-Yan, and I hope you will have a look at it. It's got beautiful illustrations by his colleague, illustrator from the hospital.
Hello.
Hi.
Can I speak?
Yes.
Actually, can I just say Jane's had a hand up, so perhaps after Jane, if you wouldn't mind. Thanks. Jane?
Am I? Yes, I'm on sound. It's been great to hear everybody's reflections. I've really enjoyed it, and thanks for sharing. Lots of quite controversial issues about retirement versus not retiring, and you'll hear my path has been a bit different. Generally, we're encouraged to live in the present, but I must say a little bit of nostalgia sometimes not a bad thing. I was in general practice, and I was interested to hear about the reluctance of people to go into general practice. I thoroughly enjoyed it. Firstly, for 11 years in London, I practiced in South London in an old-fashioned setup where the ground floor of the house was the surgery and we lived upstairs. I don't think that happens much nowadays. And then in 1988, we moved to the west of Scotland and I joined a more conventional practice here on the West Coast. I'm very grateful that I was a GP during those years and not now when I feel the general practice has changed, at least in the UK, out of all recognition. And the things from which I would have got satisfaction have now been hived off. I would have sorely missed the declining role of the family doctor. And I wonder if Lorna and other GPs on the meeting might feel similarly. So actually, I clearly didn't have the staying power that most of you have had. I'm most impressed at how many of you are still working. But I actually stopped working just before I was 60 and felt quite considerably burnt out by the pressure of general practice. My senior partner used to call me worst scenario Adams. And he was right. I suppose I did always worry about it might be this and it might be that. And on some occasions, I was jolly well right. And, you know, as you get older, that experience becomes more and more pertinent. Anyway, so what I did is I decided that I would retire and I joined my husband's business immediately. Now, many of you will remember Ted from our medical school days. He gave up teaching in his mid-50s to run a yacht charter business. And so 3 days after I did my last surgery as a GP, I joined him on board and for 5 years was acting as the hostess, the cook, and the sometimes very reluctant medical advisor. So we took 5 or 6 guests on cruises around the west coast of Scotland for 6 days at a time. We met a wonderful variety of people. We had fantastic in-depth conversations with all types and sizes. And unfortunately, I also had a few anxious medical moments, not nearly as many as I might have expected because our clientele was generally older. But I had one gentleman who joined and I was assured he was a well-controlled diabetic. And what happened is his sugars started rising and rising. And we were in an area where there was no telephone signal. So I had to kind of make decisions about him. And then the other calamity I remember was an elderly gentleman going into urinary retention when we were on a very stormy anchorage. Difficult to cope with, but you'd be glad to know all ended well, say no more. After we gave up chartering at the same time as my parents were both ailing and dying, we continued to sail for some years after. Well, we're still sailing, and that included joining a rally which took us right into the depths of the Baltic, visiting Tallinn, Helsinki, St. Petersburg, Stockholm, etc. So that was a fantastic experience. Our pace was slowing down a bit when along came 2 gorgeous grandsons who are a source of huge joy. ironically, they were born in Johannesburg, because my son was working in South Africa for 5 years. So that allowed me to reconnect with friends and family, which was super. They are now in Denmark, with Danish taking over from English as their first language. So Danish is not an easy language to learn. I don't think I'll be succeeding there. But we hope to have many more happy years with our children. And I hope that is a different slant on medicine not having to be absolutely for life. Thanks.
Thanks, Jane.
Hello.
Hi.
Hi. Thank you. Firstly, I want to say hi to everyone. It's great to see you all. Some of you I don't recognize, others easily recognize. I live in Atlanta and married and have 2 children. What happened after, firstly, I want to thank you guys for allowing me and Allard and Peter Rush and Pete Barron, who were all from Bulawayo, to be part of the South African community and go to medical school in Cape Town, which was well sought after and was a wonderful, wonderful experience. And I still tell people here, I don't know what it's like now, how great an education we had. What I've found in the States is that I'm a radiologist, diagnostic radiologist, but I've actually quit just a couple of months ago, getting on to 75. So I thought, you know, you got to think about what the future holds. So I'm going to try and enjoy those last years. I play a lot of golf. I actually played with David Westerman the other day. And David told me to say hello to all of you. The reason he's not here is because of Shabbat, and he is very observant and couldn't make it today. My stay in America, we started off in Seattle. My wife thought I was taking her to the North Pole when we went there, and then we've gravitated back to the South. And people, when they asked us where they don't recognize our accents, we say, no, we're from the South. My trip, my life after graduation, I didn't know what I wanted to do and thought I'd become a ship's doctor. And I got a job with the Chandris Lines. It was around the world cruise, but they made a mistake from Greece and they actually sent a doctor to Cape Town to join the cruise. So I didn't get my job, but they paid me the money for that trip because they couldn't take 2 doctors. And I ended up in London and I worked locums unofficially, I can tell you, for about 9 months. And I actually earned more money running around on the tubes because they paid for travel time than actually in the practices that I worked. And I worked in all different types of practices in London and surrounding area. Came back to South Africa, did radiology in Cape Town was full, and did radiology in Johannesburg. And we came to the States. I did radiology in Johannesburg. Soweto happened, and I was there. I happened to be doing my residency, the 3-month rotation at Soweto in that period of time in July when this was all on, and I was just scared out of my wits. And within 2 months, I went to the States, looked at about 8 jobs, and eventually landed up in Seattle and did a fellowship there and continued. We've been in this area for a long time now, but as we all have moved to different parts of the world, it's wonderful to see you all, and hopefully we can do this again soon. Take care, everyone.
Thank you, Max.
Can I talk again? Hi.
Yes, please.
I've just got a message on my iPhone from Rocky, who's on her iPad, and that's Rochelle Hotz. And she can't unmute on her iPad, sounds a little bit technically challenged like me. So she asked if I would mind talking for her and let the people know how much she's enjoying it. And she's saying hi to Les Landecker and sends all her best wishes. I'm trying to tell her how to unmute on an iPad, but it can be tricky.
Okay, Guy. Sorry.
I managed to unmute.
Go ahead, Rochelle, women first, yeah, and then Guy.
I finally got it. So hello to everybody. It's really lovely to see you all. I've enjoyed it. I haven't been in contact with any of you for a very, very long time. I used to see Mary Robertson in London. But Des and I see each other, and Joan and I, but otherwise I haven't. We first went to London, then we came to America. We've been here, I'm in Boston. We've been here for about the last 38 years. And I did psychiatry, and I've worked in psychiatry for the last 35 years. I did retire, but I do on-call at the hospital where I worked. And I like still having a little bit of a foot in there, and I'm trying very hard to learn bridge. I'm very sorry that I didn't play bridge with all of you guys when I was at medical school, because it's very difficult to learn at this stage. But I keep trying. I have 3 children and 2 grandchildren. And I noticed that somebody's drinking wine, but I think it's a little bit early for us here. Although it would be really nice. But I'm gonna leave soon because my one son is here, and we're gonna have scrambled eggs and boerewors for lunch. I'd love to keep in touch with you all, and it's really, really nice to be here with you. Thank you. By the way, does anybody know what's happened to Sybil Ritten? I know she's also was an ophthalmologist. So if anybody knows, maybe...
London. I think I had some sort of contact with her via some organization by email. I saw her name, but she was an ophthalmologist somewhere, I think in West London, I'm not sure.
And I wouldn't mind getting onto that WhatsApp with Lorna and you guys. Thanks very much. I will leave now. Des, thanks for stepping in for me. And I really enjoyed your those limericks. They were a lot of fun.
I'd be really interested to know how many other psychiatrists there are in the class.
Yeah, okay, well, I have to own up to that.
Oh, yeah.
So I was a psychiatrist appointed by the Maudsley Hospital in London, South London, for a long time. Had a catchment area in an outer London borough. And I also had a part-time research appointment at the Institute of Psychiatry. And what I would say about the Institute of Psychiatry is that the head of the department, Robert Murray, became an FRS, a Fellow of the Royal Society, which is saying something. So I retired from that at age 65, and then age 65 to 75, I was employed by the Ministry of Justice, sitting on tribunals, hearing appeals from people who'd had their sickness benefits cut. That chronic, severe physical illness, mental illness, and occasionally both. So I've retired a few months, well, September when I turned 75, and I lead a bone idle existence, which I thoroughly enjoy. I read the Guardian newspaper when I have my breakfast in the morning. I play internet speed chess, where you've got to play all your moves in 5 minutes, and you play people from all over the world. And I have piano lessons on my beautiful Blythner Grand. And I'm on the executive committee of an organization called Doctors for the NHS. My wife's the chair of the local branch of the Labour Party. We've traveled quite a bit. We've been to the Galapagos Islands and Vietnam and New Zealand and a lot of countries in between. But usually on holiday, I can be found under sun umbrella by the sea or a pool reading a good book. Now, what I'd like to say is Professor Speaker's been quoted, and here is his book, okay? Action Uses of Drugs, okay, which I'm sure you all remember. And I was trying to find, because we're going to have a glass of wine or something other when John Evans gives his conclusion. And I was trying to find a quotation which I remember from it. And the quotation is, have a glass of wine for the sake of thine heart, okay? Now, the trouble with Speaker's book is a bit out of date. Because in fact, there have been studies showing, it used to be said that if you had 1 glass of alcohol a day, it had a cardioprotective effect. Brian first might say something about that. But in fact, the more recent research is that that's not the case, that just alcohol is just damaging. The more you drink, the worse the effect. So this quotation from Speaker's book is wrong. And the other thing I'd like to just tell you about is an incident. I live in London, South London, and we were traveling by plane from Cape Town to Johannesburg, and there was a message which came over the intercom: is there a doctor on the plane? And there was an old chap who had become suddenly unconscious. And so I, a psychiatrist, arrived on the scene, and the other doctor who arrived was the health administrator. And so I thought, I spoke to his wife, and it seemed as though he'd once previously had a TIA, but the health administrator thought he had a cardiac arrhythmia.
For 3 years.
So there was two opinions from two individuals, probably both wrong. Anyway, what happened was then the message from the captain: should we land at Bloemfontein? Should we bring the plane down at Bloemfontein? And I thought, my God, I don't want to go to Bloemfontein. But anyway, fortunately, he suddenly woke up. And so the plane landed in Johannesburg, and a Cuban doctor, a woman with heavy boots, came thundering down the plane, followed by all sorts of equipment to measure his blood sugar and his cardiogram and goodness knows what. And so he was taken off. So I'm sure other people here have had experiences of having to be a doctor on the airplane. Okay, that's all. Thanks.
And when that call comes, I usually hide under my seat.
Yes, I once flew with 18 cardiologists on the plane, and the only person that jumped up was a psychiatrist. It's a bit weird, but it's true. It's usually vasovagal. They usually pass out because they just drop their blood pressures.
Hi, hi.
Hello, I guess I could say Jason.
Hi, can I say hi, everybody? Nice to see you all, and nice to hear all your stories. I qualified as an orthopedic surgeon in Cape Town, and I've been here all my working life. I spent about 6 months to a year in England, mainly in Wales, as part of my postgraduate work. Eventually got married at the age of about 50, and I've now got one son who is in 5th year veterinary student at the moment. So I have to carry on working until he qualifies, because they're also a 6-year course. Anyway, I was working virtually full time until COVID arrived. And once COVID arrived, it's changed my whole life. So I'm semi-retired now and enjoying it. So there are lots of things to do. And yeah, and pity that COVID came in, because we can travel, we'll go all over the place, do worldwide travels, and then COVID came and just took it out, stopped all the planning. So we're hoping that there'll still be time for us to do that when the COVID epidemic or pandemic settles down. As far as the local scene is concerned, I agree 100% with Adi Horek. What he said was on the button. It's about the country and things going on here and NHI. Anyway, lovely to see you all, and maybe we should meet in a year's time, as Mary suggested. Thank you.
Thanks, Jason.
Yeah,
Can I jump in here at this point?
Yes, although Clive, you had your hand up for a long time.
Well, I did have my hand up, but I sort of decided to take my hand down again. But I just
sorry, far away then.
I just want to say that it's really remarkable to hear all these amazing stories. Our class has kind of covered the world in a way. It's quite amazing. So I would just simply say I quit suddenly at the age of 66, and you know, it's a whole different occupation not to work. How to keep busy and how to be creative. It's quite a challenge, and I think I've learned a lot. Somebody's taken. Can you hear me?
No, we can hear you. Yes.
Yeah, we can hear you.
Oh, well, okay. I'm sorry about that. But anyway, it's been wonderful. I was a pathologist here in this small town in the middle of Pennsylvania, and basically I haven't moved. Got involved in hospital politics and that sort of stuff, and quickly learned that I wasn't quite suited for that, since I had the very bad idea of saying what I thought. And so I just stuck to my medical skills to the best of my ability. But it's just been wonderful. I appreciate what you guys have done to put this together. And we should do this once a week or once every month. It'll be great.
Okay, thanks, Willem.
Hello, it's Guy Jones here again. We all owe a huge debt to the University of Cape Town Medical School, which has given us all wonderful lives. I've lived most of my life or working life in Virginia, where I'm a hand surgeon, microsurgeon, transgender surgeon, breast surgeon. I have a very busy life. I'm on call. I'm the chairman of the department, heavily involved in academics, and I still can work with the microscope, replant fingers and other things. However, as we measure our lives in quantums of 25 years, I think back to the great reunion we had 25 years ago. And if we can probably shorten the time a little bit, maybe we should have another reunion in Cape Town. It would be wonderful. It seems that the advice we get today is that retirement is fine as long as you keep pickled. Was that what did I get that right? I'm not sure. Anyway, Bridget Reed accosted me, thank you, accosted me at the meet and greet 25 years ago. She said, Guy, I still haven't forgiven you. Is Bridget Reed anywhere here? I want to know if I've been forgiven. And I thought terribly that night about what did I do to offend Bridget Reed? And so I found her the next day and I said, what did I do to offend you, Bridget? She said, well, you were one of those dreadful people that played rugby and were partying and on the beach and whatnot. You never seemed to come to lectures. And she said, and the night before, I think it was forensic medicine exam, you had not been to a single lecture. You asked if I could borrow my notes because I had good handwriting. And you said, then damn it, you passed and I failed on my notes. It was appalling. So I wonder, after 50 years, if Bridget could finally forgive me. I don't know. The other person I would love to see is Jimmy Runciman. We share an interest in Morgan motor cars. I wonder if he's still lurking around in Adelaide. I don't know. It would be lovely to hear from him. I really have enjoyed this adventure. Thank you so much.
Thanks,
I could say, not an ally. Yeah.
Okay, Farah, yeah. Martin?
Oh, brilliant. Sorry, I've got your face up there, Morris. It's great seeing everyone, and well done to the people that put this together. It certainly everyone's had something to say that resonates with all of us. Liz mentioned standouts. Personally, I thought I was a standout in the class as being about the biggest screw up in the class. I'll challenge you, Guy, on attending less lectures. And the person I'm missing seeing today is Joni van der Ende, who hauled me out of the big and whistle one night after really seemed like a bad sup in pharmacology yet again. I think I was the king of sup swallows there, but one of the more important things that comes from all of that to me is how well we were educated. I've never once been embarrassed about one's background. I spent 42 years in one job, and rather sadly, the one hasn't heard so far is disability. I went out on disability and with Parkinson's, and I wanted to get a word in before my levodopa ran out, which it's rapidly doing at the moment. But it's really difficult to wake up one day with a fairly busy career. I did pediatric cardiac anesthesia most of that time, and suddenly wake up realizing you've got something wrong with you that isn't going to get better. But exercise is what I'm doing. Unlike everyone else that seems to have an important medical reason for leaving, I've got a tea time in about 15 minutes, so I will quietly slide away and save my toast for a bit later in the day. But thanks, everyone. Great seeing all sorts of people up on the screen. Dave Mitchell is probably the only one I continue to communicate with on a regular basis. And it's always great to see Darby. Barry Clements has been through here. We're blessed with the fact we live in Carmel at the moment, where the temperature yesterday got up to 75. And it augurs well for cars and other bits and pieces that one spends one's time with. But great seeing all of you, and thanks to the people who put this on.
Thanks very much, Martin.
I wonder if I could have a word or two again.
Yes, please, Max.
Yes, I was interested to hear everybody's stories, particularly those who are in general practice, Lorna and Jane. Like them, I joined general practice. It wasn't initially my intention. After graduating, I earned quick money, which subsidized a 6-month stint in London. And in that time, I went across to Dublin and did a surgical primary as I landed a job in ophthalmology, which I didn't actually pursue. I eventually did other bits and pieces and went into general practice, where I've been practicing for more than 40 years. I was very privileged to have worked with a very old doctor, Dr. Sennett, who unfortunately died last year. He was 101 years old, and in fact, he continued working till he was over 90. We had very busy practices both in Claremont and Athlone. Athlone in particular was a huge practice. Unfortunately, that fell away. And at the moment, I'm in solace practice. I still work. I enjoy working. I'm physically pretty active. I gym most days. I walk a lot. Very blessed to be living in a house in Cape Town with a big garden where I spend a lot of time and so on. And I must say I was very, very grateful during the COVID time to have the privilege of working. From day one, I managed to get to work, because initially we had a lockdown, total lockdown, where nobody was allowed out. You couldn't even take your dog for a walk. And I went to the rooms, not that it was exactly busy, but at least I got out of the house. And we've also had a bad time here in Cape Town with the COVID. It's now, fortunately, I think, on its way out. And yeah, so I was actually hoping to host you guys in my garden in Cape Town. And this never, unfortunately, happened with the Omicron variant breaking through. And hopefully we can do this in the future. So let's hope so. ASAP. Thank you.
Thanks, Max.
Can I come in now, please? It's Joe Lund here from Cape Town.
Hello, Joe.
Yeah, no, it's interesting that our reunion a long time ago in Cape Town and now again, The number of people who are participating is very heavily in favor of those who have actually emigrated and done this university and the rest of us incredibly proud what they have actually achieved. And well done to all of you. And thanks for coming on board and for the representation that you have been able to add to this evening. Just before I go on to what I really wanted to talk about, I had a little anecdote about flying in the plane. We were traveling from the UK to Canada on a holiday, and to see my son who was living and traveling around there. And along the way, we had one of those calls coming on, is there a doctor on board? Well, I'm a pediatrician, and somebody was having something related to, elderly, aged, hyperglycemia, diabetes, TIAs, whatever it was, terrified the hell out of me. I slid lower and lower and lower in my chair. But eventually, when it got to the third call, I very gingerly caught the eye of the air hostess, put my finger up and beckoned that she came over. And I said, for heaven's sake, I am a pediatrician, I am a doctor, but I have no knowledge of what might happen to adults. Is there nobody else? And she said, there's only a third-year medical student who's come forward. Anyway, I went and saw him. Unfortunately, he was just hyperventilating and very anxious, and a little bit of calming and sugar water and what have you they could produce, and he was fine. I just wanted to bring up something in a discussion which is really quite striking, as again, along the lines of the many people who have gone overseas, and unfortunately not a great support from people who've remained locally here as far as this Zoom goes. Although there are a lot of people, and some of the cream of the crop have contributed enormously to the Zoom meeting, as we've already mentioned. I spent some time in the UK and had a wonderful year traveling around and doing what people did in those days in a combi, which we bought on Trafalgar Square, and then got a very good job at Queen Charlotte's Hospital and subsequently at the Northwood Park Hospital. Had a wonderful time there. And through the research centre at Northwood Park, I met an Australian who came directly from the intensive care unit at the Melbourne Children's Hospital. And through him, I managed to secure an internship. Now, in the state of Victoria, the appointments for the next year are all announced on a particular day. So we waited with bated breath for this, and I already had somebody who was buying my car. I had people who we were going to give our furniture away to, and we were all set to leave for Australia. And I had a call from the head of the ICU saying that he unfortunately could not actually get me a visa, and my job fell through. Never really found out why I didn't get that visa, but that was back in the days in 1981 when we were the whipping boy of the world. Whether it was that or whether there was other reasons, it doesn't matter. Anyway, things play out well sometimes, and it was fortuitous because we came back to South Africa, and I must say that we have been incredibly happy back here in the country in spite of lots of hardships. There is a lot that we have to live with in South Africa, which day by day makes us feel guilty. People who, there are masses of people who are living below the bread line, who come around begging at the gates, at the traffic lights. They hold up placards, they're begging for food, they're begging for handouts, they're begging for jobs. And we live in this world. But at the same time, the quality of life that we have been able to secure for ourselves, and I hate to say it, but thanks to the apartheid years, although we disagreed greatly with that policy, we inevitably, having been born white, have really benefited, from being in this country. So I've been able to educate my children really well, my 3 children, one of whom has moved to Adelaide now and lives in Adelaide, Australia, and my other 2 children here as well. But we have done well, and I too have now retired, having done the exam for pediatrics in South Africa, then did the MRCP in pediatrics in the UK, with a view to getting into Australia, because my wife's parents lived in Australia and her brother still lives there. And then when everything fell through, came back here. So had a wonderful career in pediatrics, but stepped down at the age of 68. And I'm very pleased to see that some of my colleagues who are part of our 4x4 group are on this scheme today. And we head out as much as we can into the never, the deep depths of places like Namibia, Northern Natal, in a group of 4 of us in our 4x4 vehicles, and we have wonderful outings. And I have not regretted retiring at all. Pediatrics, incredibly busy, nights on call, weekends on call. And although I was part of a partnership when I got to 65, 66 and older, those calls were becoming quite strenuous. And I started losing a little bit of the confidence with the very high level of neonatology, intensive care neonatology we were doing, which I used to specialize in a way. And I just kind of felt that I was getting to the point where I needed to step down. So I stopped doing neonatology and nights on call in the last year before retiring. But we're loving it, playing bridge, as some people have said, traveling a lot, enjoying the country, enjoying the environment, enjoying family. And yeah, for those of you who don't know what they're going to do in retirement, I think you need to think hard about what you're doing to yourselves. For people who are intelligent like you, who don't know what to do with a little bit of time off, I have to question whether, in fact, that's really true. But Morris, thanks very much for taking over the chair here, to Melody, to Janie, to all of those who've done an absolutely sterling job here. Thank you very much. And yes, it would be nice to be able to repeat this again. Thanks, everybody, and thanks for joining.
Thank you very much, Joe. Melody, you got your hand up?
Yes, it's interesting that Joe should have spoken about the local scene. I just wanted to speak in support of South Africa too, actually. I have worked as a specialist physician, both in Cape Town and Johannesburg, and mainly in the fields of clinical hematology and rheumatoid arthritis. I'm married for over 40 years. We have 4 children, and we have 10 grandchildren. And one of our children, the only daughter, is a pediatrician at Red Cross Hospital. I don't actively work anymore, but I keep all of my registrations current. And I do try to read every single day. Jane's dad told us at the time of our graduation that to be a good doctor, you need to learn a new fact every day. And it's always stuck with me, and I still read daily. And I find myself quite often being called upon to give thoughts or opinions. And I really love that. And it causes me to delve into information that maybe is not current in my mind. And I love that. Life in South Africa isn't that easy, but it's better than it was in our day. I believe that. I really do. And I feel that in aspects of medicine, I've had personal stuff at Rodowski. My daughter's at Red Cross. My husband has had treatment in the cardiology department. I've been intimately involved with COVID. I think the standard is incredible. I think we are somehow given sort of cold shoulder by people overseas who feel we're not up to it. And I feel that the identification of the Omicron variant was a great lesson to the rest of the world. Actually, we didn't start Omicron, we discovered it first. But more than that, I'd like to say that I agree with everything that Adi and Patrick are concerned about. They're dead right. But if one stays on in this country, one has to make some sort of a decision that on a daily basis, you're going to try and make it better. If you don't feel that, it's almost impossible to live here. So one of the things I'd like to say is we need tourists, we need money spent here, we need ideas, and please, please come and visit. We live in Johannesburg, but we spend a lot of time in Cape Town. I can tell you the last month in Cape Town has been simply wonderful. Please don't stay away, please come soon. And when you are here, we'd all love to see you. We might not be able to put together a huge gathering, but certainly many of us here together would love to see all of you from overseas and could put together smaller groups very, very, very easily. So please, please come and visit. That's really what I wanted to say.
Thanks very much, Melody. Michael, you've got your hand up.
Yeah, I had a suggestion and a request. It seems that everyone is very happy to have been here, all like this very much indeed. Would it be possible through the centralization at UCT to set up maybe a WhatsApp or a Telegram where we can at least keep in contact with each other as time goes by? Because I know there are many other small groups together that are doing it, and we can maybe have a class one where we can at least occasionally say something or learn from our others. Just a suggestion.
Okay, well, in fact, Linda has got a small WhatsApp, so we could ask her to enlarge that. Jane, Melody, I don't know what you think about that.
I think it sounds a great idea. I don't know how many people can comfortably be on the same WhatsApp. The WhatsApp that Lorna is talking about, I'm also part of, and it is a fantastic group. But I think there are 5 or 6 of us on that. So I don't know when one extends it more than that, how easy it is to control. But I certainly feel that we should look into that. And I just wanted to mention that one of the sendouts that went was about photographs. Maybe this is just appropriate to say that the idea was that we were going to ask people for photographs. And initially we thought, well, they could be shown on this forum. And then we realized it simply wouldn't work. So the current thinking is that in the next couple of weeks, we would hope people would send photographs. People had different ideas. Hester Muller suggested one photograph of then and one current. And that each person could then write a story of whatever was on their minds, and that we would collate these into some form of online booklet that could be available to everybody. So we will get onto that, and everybody in the class will receive the opportunity to do this, and it will be very nice. I hope it works. It's another project, but let's hope it works. And whatever anybody has any ideas, please forward your ideas. We're only too happy to follow anybody's ideas.
Right. So we get an email to that effect, would we, Melody?
You will, yes.
Oh, great. Okay, Gary, you've got your hand up. Are you muted?
Can you hear me? Hello, everyone. It's Gary Rose, for those of you who neither recognize nor remember. It's been 50 years after all, and I missed the 25-year anniversary, unfortunately. But it really is nice to see all the familiar faces. They really are. I would have recognized, I think, everyone. Of course, the name helps a bit at the bottom of the screen, but all the features are there. I'd like to just confirm what you say, Melody. I think if we stay here, one's got to be positive, and you've got to do something good every day, at least one thing, as you say. I'm amazed by the number of people who either became ophthalmologists or had an interest in ophthalmology from our class. And it's especially amazing because our ophthalmology lectures by Prof. Civil were given on a Monday morning in the dark at 8 o'clock. I wonder if anyone remembers that. I remember it, but I quite frankly don't really remember anything that he said. And then we had a 2-week course in ophthalmology. But I did ophthalmology after a stint in general practice, a short one. Janie, I know exactly what you're talking about. It's the most strenuous thing. We were in the town where I grew up, which is a town with a small hospital, and it is a very difficult occupation, very, very taxing. Anyway, I've been in practice now for 30, I don't know how many years, 30-something years. I stopped when COVID started. I stopped surgery, and I limit my practice now to just the clinical work on 1 day a week. So I'd just like to endorse what people say about retiring, and maybe not retiring completely. There's a lot to be said for keeping your interests going, no matter whatever they are, as long as they're related in some way to your medicine. I find it most stimulating still to go in 1 day a week. It gives one a purpose. Also, you can do something medically related. I took an interest in philosophy some years ago, and I completed a degree last year, and I'm now following a particular interest in that line. So there's still lots to be done. Finally, I can confirm that Clive Mcdell really was a highly respected ophthalmologist. And it's really very sad what happened to him. And indeed, it's quite amazing that so many members of our class are really academically illustrious individuals. And I mean, I'm quite staggered. I find it amazing that so many people from one class can be such high achievers. So anyway, it's very nice to see all of you, and thanks to the organizers.
Thank you, Gary. Marion Jacobs, you put your hand up.
Yes, thank you, Marius, and good evening, everybody. Sorry I came in late after, I think after the introduction. It's been a very interesting evening for me because of the people who are on the call here. I think I've only had contact with 2 people, 3 actually, Joe Lund and John Hibbins in Pediatrics, and then Max Harris about 2 months ago. And I think that's probably not surprising when many of you are out of the country, but even people in Cape Town I've had no contact with. And even the conversation that took place on this call, I didn't know a lot of the things that you were talking about in terms of the history. But I just wanted to say a couple of things. One is that I think it's really useful to have this kind of connection going. And it would be even more useful if we could think about how this group of people that have achieved so much academically all over the world, can actually support what's going on here. I don't know if Lionel spoke about the need for funding, but certainly I think it's something that we should think about. I also wanted to say that about retirement in South Africa, whether you are in a university or in the public service, when you reach the age of 65, they basically scoop you out. That's what happens. And then you have to find your own way, either doing all the kinds of things that people have spoken about. I've had a very interesting time since retiring. For the first couple of years, I worked with the National Ministry of Health to establish a leadership and management academy. And for the last 2 years or more, I've been the co-chair of the National Ministerial Advisory Committee on COVID. And that has certainly been an incredibly enriching experience in so many ways, to see how South Africans pull together when faced by a challenge like COVID. I want to just agree with Melody that what we've started realizing is that we must stop looking to the north for guidance around COVID, because what we have here is a bunch of absolutely brilliant scientists. Tulio de Oliveira, who did led the genetic sequencing team around Omicron, has just been named as one of Nature's 10 leading scientists in the world. That's no mean achievement. We also know that in the last month or so, when our people made a decision to reduce isolation time for COVID from 10 days to 5 days, we were followed subsequently by CDC. So actually, I think we're doing pretty well at this end of the world. And as much as I can never say people should never have left. I can also never say that you should come back. In every case, people have had reasons why they had to leave. And wherever you've been, you've made hell of a contributions to the practice and science of medicine. The most interesting one that I heard this evening was somebody who I think said that he deals with hands, breasts, transgender issues, and several others. And that is certainly quite an achievement with that range of skills. And I have to say, he was wearing a beautiful tartan jacket. So I did notice that as well.
I have no idea who
So,
that was.
what's that?
I have no idea who that was.
Yeah, me too. But for the people in the UK, you can take some hope. South African wine is being exported yet again. During COVID, we benefited because we got whatever couldn't be exported, we got at reduced prices. But we've gone back to the old prices, and I think you can look for our wine everywhere, including Sainsbury's. So thank you to the people who have contributed and to the people who organized this. And thank you so much to Max for having offered his place. His garden is beautiful, and he was really, really disappointed that he couldn't host a gathering. But I would certainly hope that there is an opportunity for us to meet face to face and actually talk through a number of things that make us happy, because that's what we need to do now that we're 74 or thereabouts, as I am. So thank you, everybody. Thanks to Linda and Tembakazi for putting this together and for responding to our moans about the fact that the faculty had done nothing. And I think that now that Lionel has seen everybody, he may well fund something in the future. And Stewie and Mary and Adi, I really thought you were going to sing tonight. I'm very disappointed that the medicos didn't pull their act together. Thanks, Morris. Good to see you.
Okay, thanks. I'm just wondering, it's time for the taste from John Heavens and also his concluding remarks. Is there anybody else who wants to come in with a final word before John Heavens takes over?
Morris, I'd like to have a final word.
Okay.
Could I just have another word, please?
Yes, please, Bernard.
Okay.
Sorry, Max. Sorry, who's your
Tubby. Yeah. Okay. I just want to also end off by saying that, talking about being called on ships and planes, I've been fortunate to be a ship's doctor a few times around the world. We had a lovely trip to Italy and went around the Horn of Africa, stopped at Mauritius, Seychelles, Reunion, and went to Egypt and saw the pyramids, stopped in Israel, and then ended off in Genoa. And besides that, I'm very blessed to have 2 wonderful sons and 5 grandchildren. And I've just come back from London, where it was freezing cold, spent a wonderful time with my son and family. And today it's been extremely hot, and very privileged this morning to have a lovely run on the beach with our dog. And lots of people then, you probably saw pictures in the paper where Sea Point Pool was overcrowded with people, but they really enjoyed the swim. And I won't talk too long because, we're running short of time, but thanks again. Thanks for organizing. Wonderful to see you all. And as we said, hopefully we'll get together. And Max again did a wonderful job, and to Mary and everyone else and yourself, thanks very much and keep well. Bye-bye.
Thanks very much, Max. Okay, over to you, John Heavens. You're muted.
Yeah, I just suddenly realized. I think I'm okay now. Yes, so first of all, please, everybody, charge your glasses. You may have seen that I, despite the modern science, have been actually enjoying a really good South African red. And who would have thought 50 years ago that you would still have me here in front of all of you guys, droning on about whatever. Anyway, I would like to, first of all, again, offer thanks. I think this has been a fantastic event. The organizing committee, both from UCT and the various sort of medical staff who've been involved, have done a sterling job, and sort of just coming in at the very end, I've realized how many obstacles that they've had to actually get over. And especially to Morris, who's put a huge amount of effort in and has been such a great host for us this evening as well. I think the words that we had from Patrick, Lionel, and Melanie were absolutely wonderful contributions. And hopefully it certainly made me think about a lot of things and hopefully stirred a whole lot of memories and thoughts in your various minds. But most of all, I would like to thank all of you guys for coming on to this session that we have. It's been really catching up. I think I've heard echoes from many people that I haven't been in contact with many of you along the way. In fact, very few of you along the way. And I have thoroughly enjoyed this evening and would really like to see that we do continue this. So thank you all for coming together here. So just to sort of round off, to those that have passed, we salute you and we miss you. To those who have not been able to attend for whatever reason, we've also missed you too. And I think we've heard of a number of people from that one. And to you all, we wish you a very good 2022 and all the best for the future. So please raise your glasses and let's toast the class of 71. To the class of 71, salute.
L'chaim.
All those wonderful words.
As in Willem Lubbe. He said L'chaim. Yeah, why not?
And then,
I didn't know he's not Jewish. Isn't.
So really it's now goodbye and take care. Except in passing, I live in a wonderful little town called Stratford-upon-Avon, which many of you probably have heard of, which is right in the middle of England. And if any of you are ever passing, please feel free to contact us and come and have spend some time with us. My wife and I would love to catch up with you. Take care.
Ciao.
Thank you.
Right.
Thanks, guys. Bye-bye.
Bye-bye.
Thanks, everyone.
Bye.
Bye.
Thank you very much. Thank
Nice
you.
to see you.
Thank you.
Thank you, everybody. Thanks. Bye.
Cheerio.
Bye.
Bye-bye.
Bye-bye. Bye-bye.
Sorry? Yeah.
Yeah, thanks, Max.
All right. Bye, Stewie.
I'm picked off, Tubby.
Hey, Stuart.
Dogs.
Nice to see you, mate.
Still remember your mum teaching me pediatrics at in Pietermaritzburg.
We used to study together. She was a good girl. She's in Boston.
Guy? You there, Guy? Yeah. Remember looking after your mum in Claremont
Talk to these people who
Thank you.
as a GP.
I know. Thank you. Thank you.
Chris Radloff, yeah. Looked after your mum.
Just see if I can get hold of Rocky, yeah?
Where?
Yeah, there's Rochelle.
Oh, are they still there? You can just talk if you. Oh, okay. Well, there's just a bunch of people. It's not like it's
Still keeping the
it's not a
faith,
personal
Mary?
thing, it's just a group thing.
Yes, I'm so sorry. Am I here?
Yeah, you're still keeping the faith.
Oh, right. All right. Thank you. Bye-bye, everyone. It's been fabulous. Oh, there's Stewie. Stewie.
I'll have to email Rocky.
Stewie. Where is Stewie?
I think all their email addresses are in there.
Yeah.
How's Nathan doing, Max?
Maybe they'll put a spreadsheet together that follows their names and emails.
Max. Max.
I think I've given all the emails.
Gary?
Yeah.
How can I get
Yeah.
hold?
How's Nathan doing?
Rochelle?
Nathan Bogan.
Have you taken off mute?
Hi, Rochelle. Les here.
Thank you for looking after some of the other parts of my
Just press your mute button.
Yeah, can you hear me?
Yep, I can hear you. How are you?
I'm great. Nice to see you. Other people listening too.
I just want to tell you, my granddaughter is at Tufts.
Oh.
So she started just about 6 months ago. So my wife went down to see her, but hopefully when things clear up, we'll come down as well. I'd love to see you again.
Yeah. Do you have my? Can I give you my phone number?
Yeah,
Or-
okay, I'll write it down now. Has
Okay.
Richard still got it?
Yeah. But you can't have a grandchild in college.
She's 18. Yep.
Oh my goodness. That's wonderful. It's wonderful. I'll give you my number, 617
617
965
965
6977.
6977.
Yeah. And Liz, if your grandchild needs anything at any time, please, we're here.
Yeah. No, she's loving it there. She's absolutely having a ball. She loves it.
Oh, good. Good.
My son lives in California, so I said to her, "Are you crazy to go from California to Boston?" So I think the cold is something.
It's minus degrees right now.
Yeah, don't tell me. Toronto's about -14 today.
Right. How long ago was that when we saw you in New York?
Yeah, that's what it was. 2013. Jenny's just telling me. That was amazing. I really enjoyed it.
Yeah, it was. It was very nice. Yeah. Good. Well, nice to see you and everybody else who's still on there. I still see people.
Are you still rowing?
We didn't this year because of the COVID.
Yes.
Yeah. And so
what other things have you been doing?
Yes, I'm trying to learn bridge.
Okay.
I've been playing bridge for the last few years, and now we play online all the time.
Yeah.
And it is the most difficult thing. I think it's harder than medical school. It is the most difficult thing to do.
Yeah.
And I'm going to Chicago on Sunday to spend a week with my daughter and grandchildren there. So I work about one weekend a month.
Yes.
And playing bridge, reading, taking care of the cooking and the shopping.
Yeah.
And the husband who demands a lot of attention.
All husbands demand a lot of attention.
I don't know why.
Demand is not the right word.
It's okay. It's okay. We're all the same. Anyway, I'm going to catch up with you when we come down to Boston. Yep. I'm going to definitely contact you.
Please do. And if your granddaughter.
Granddaughter. Yeah, she's
Anything at all, give her my number. Okay. Just as a backup, we're here. I know Richard and them are also here, but we're here.
Okay.
And I'll see you sometime soon.
Lovely.
Okay.
And lovely to see you again.
You too. Take care, Liz.
Take care.
Bye. I don't know how to leave this.
Expert at the iPad. I think he's looking. Zoom here.